Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Welcome, you're Mr. Jefferson, correct?
Yes, that's correct. You can call me Tom.
Great, Tom. Your primary care doctor referred you to me because you're having issues with tendinitis, I believe.
Yes, that's correct. I've had problems with it on and off over the past year or so.
All right, I've got some notes from your doctor, but why don't you give me your perspective? When did your tendinitis first appear? What treatment have you had? What worked for you? Anything you can recall?
Sure. It started when I had a mishap at the gym, probably around 2 years ago. I was doing some heavy lifting and felt a sharp pain. That slowly improved, but the tendinitis popped up about a year ago. It took a good 3 months for it to really get better. Now it's back and has been troubling me for the past 2 weeks.
And your doctor confirmed it was tendinitis?
Yeah, I was having this pain in my elbow, and she said it was due to overuse and inflammation of the tendon. The pain was sharp, and it would worsen when I tried to lift something, or even just when I moved my arm. The worst part was that I couldn't even hold a cup of coffee without feeling pain. At times, my entire arm felt numb. It was pretty strange. Due to all of this, I was unable to continue my job as a warehouse worker properly.
How did your doctor manage this condition?
Initially, she gave me NSAIDs for the pain. I was also told to apply ice packs. That did provide some relief, but I was still unable to use my arm freely.
Okay.
Later, she referred me to a physiotherapist, and I received some therapy sessions, but the improvement was minimal. Then I was referred to an orthopedic surgeon who advised a few exercises and massages to do at home.
Did you receive any other kind of treatment?
Yeah, I was given a corticosteroid injection for the inflammation and also tried therapies like ultrasound and electrical stimulation therapy. I even thought about trying acupuncture, but by then my symptoms were starting to lessen, so I decided against it.
Which treatment would you say was most effective? What made the significant improvement?
Honestly, I can't pinpoint a specific treatment because it took almost 2 months without any significant improvements. But then in the 3rd month, I noticed a drastic change. I believe it was more of a cumulative effect of the treatments rather than one single treatment.
Did anyone discuss with you what might be causing your tendinitis?
Most people guessed it was due to my heavy lifting at work, but no one really confirmed it. I know there's this condition called golfer's elbow, which causes pain on the inside of the elbow, but that wasn't exactly what I had.
Did anyone ever talk about how your lifestyle might be contributing to your problem?
Well, I remember.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Peter Mitchell, please come in. Have a seat.
Thank you.
So, your GP referred you to me due to a concern about your foot, correct?
Yes, I saw him about a month ago because of this rash on my right foot. It's been coming and going for a while now. See, it's here, on the top of my foot. It has faded a bit now, but my GP couldn't identify it, so he recommended I visit a dermatologist. He sent some pictures. Did you get them?
I did receive them, yes. Could you describe the condition to me a bit more? The feeling, symptoms, and...
It starts with a burning sensation. I get this tingling and the urge to itch at night. After a day or two, I notice small red bumps. They merge into a big patch over time. The whole area feels hot, and the skin around it gets swollen. My GP called it unpredictable. It eventually calms down, and a scaly patch forms. After about 3 weeks, it heals, leaving a discolored patch like you can see now.
I see.
This first happened to me when I was working in Africa in the early 2000s. I had a project there for a year or so. The first time, I also had a similar rash on my arm, but that never returned. This one on my foot, however, comes back, say, every 2 years, never at the exact same spot. I thought it was something to do with the environment, but then it returned even after I moved back. It doesn't seem related to my lifestyle or diet or stress levels. My GP thought it would be best if you took a look, also because I had a basal cell carcinoma on my neck removed back in 2010. It was detected quite early and was superficial.
That's good to hear. Let me just take a look at your neck. Was it here?
Yes, that's the spot.
Okay, well, everything seems fine here. I don't think this foot condition is anything severe. Have you ever had issues with athlete's foot?
No, not that I recall. But I did think this could be some kind of fungal infection. Isn't there an antifungal cream I could use to prevent it from appearing?
There are antifungal creams, but they work best when there's an ongoing infection. It might not be as effective in preventing the onset of your condition, given the thick skin on your foot.
I see. Is there a risk of the area getting infected? Should I keep it covered?
No need for that unless the skin breaks open. It should be fine otherwise.
That's a relief. The condition hasn't really affected my daily life significantly. I just thought it was high time to get a professional opinion.
Okay, so you primarily wanted to know if there's a way to prevent the rash from reappearing. The best course of action now would be to schedule a skin biopsy. It may be slightly uncomfortable, but it will help us eliminate certain possibilities.
All right, sounds good.